Hi, Kevin McCarthy here with Men Therapy, back again to talk more about trauma. Right now, I want to talk about um, how we interrupt this trauma process. How do we get in there and start to make changes that can help our bodies heal? Probably one of the more important videos we'll share here. So we've talked in the past about fight, flight, and freeze and had spectrum of engagement that our bodies have with threat. We've talked a little bit about the symptoms that engage at different points on that spectrum, whether it's anxiety and the fight or flight aspect, or whether it's depression and dissociation in that freeze aspect. Today I want to talk a little bit about what do we do? Like, how do we help ourselves when we know that we're stuck in something, right? So first off, it's important to know yourself. Feel where your symptoms are, right? And when I'm working with people, I'm a somatic guy. I'm not a psychotherapist. So I'm asking people about their bodily experience. And the nice thing is this is something you can do for yourself really easily and generally pretty safely too. And we do that by noticing, okay, what's my dominant symptom? Do I feel stuck in fight or flight, or do I feel stuck in freeze? And in that symptom, say it's a little bit of depression, where do I feel it? Where do I feel slow or dissociated or empty or quiet even, right? Where in my core can I track those feelings? And once we've identified, say, one of those places, what does it feel like to be with that, right? That's the feeling of our trauma. And when we do this at Mend, we're trying to do this gently and slowly and with a lot of support. So it's important that you try this too, gently and slowly with support. What do I mean by that? I mean, if you have a lot of trauma or a lot of memories that correspond to trauma, don't start with the biggest one first, right? It starts with something maybe that happened during the day last week. I felt pretty depressed last week. Nothing was going on, but I wasn't feeling too good. That's a place to start slowly. When I say gently, I mean notice these symptoms, but don't dive into them. You're not trying to push your way in. The thing about trauma is it doesn't heal because you go fast. Trauma moves fast. Healing moves slow. So how do we slowly engage with these symptoms so that there's space and time to manage them, right? And support is oftentimes the presence of another person. So if you're blessed with a partner, a friend, a loved one, anybody who you feel safe with, who can spend some time with you before, during, or after one of these experiences, that's going to be helpful because another nervous system room helps a lot with feeling safe. If you don't have that, you can use a memory of that. You can use a environmental thing like a nice place like on your couch in a favorite corner under a blanket with some pillows. You can do it in an environment that you like, going for a walk in the forest, finding some water. You can do it by giving yourself a feeling of safety, however you connect with that. But whenever you start doing these kind of practices, you want to start with feeling where something is safe or getting your body to a place where you are safe. Then when you go into that symptom that's scary, hurting, or traumatic in nature, you're going to already be bringing what we call resource to it. So say now you've got your resource and you've felt your place of symptom, right? What we're looking for is to just be with both of those things at once. Can you feel both safe and depressed or anxious, right? And can you locate it in your body? Can you have a felt experience of it? And the thing that this does, as you stay with it and as you're just patient with yourself, is that you're giving your body a chance to feel the difficulty of your symptom, but in a safe place. And what you're doing is you're recontextualizing that trauma in that moment when you're both feeling it and feeling safe. The metaphor I always use is if a bear is chasing you in the woods and you stop to smell a rose, something in your body is going to recognize that something isn't right about this. Maybe there is no bear, because if there's a real bear, I'm certainly not going to stop and smell this rose. We need something to tell our bodies that we're safer than this situation appears to feel, right? So, I hope that makes sense. Start noticing where your resources, start feeling into your bodies where your trauma is, and then start to slow down and relax and see if you can do that safely. Thanks. We'll welcome your questions. See you next time.